Hey everyone, have you ever stopped to think about how much AI is changing pretty much everything?
It's everywhere, right?
Yeah, it really is. And get this, it's even changing the world of orthodontics.
Wow.
Dr. Baxman, a real expert in the field, just gave a super insightful talk about it.
I'd love to hear what he had to say.
Well, get ready, because we're going to break it all down, how AI is speeding things up and changing the way they take those yucky impressions,
Thank goodness.
right? So where do we start?
Let's talk about time. One of the biggest frustrations for both patients and orthodontists is how long everything takes.
Oh, yeah. Dr. Baxman really hit on that, didn't he? Traditionally, orthodontists have spent so much time just analyzing x-rays, photos, and growth patterns.
To figure out a treatment plan, right?
Exactly. But AI is like a magic wand. It's streamlining everything.
How?
Well, Dr. Baxman talked about this system they're using in the Emirates called CFOD.
CFOD?
It stands for Computational Formulation of Orthodontic Referral Decisions.
A bit of a mouthful, I know.
Okay, so what does it do?
Basically, it uses AI to look at all these different things that affect how someone's teeth fit together, their malocclusion, and it helps determine if someone even needs to see a specialist in the first place.
That's pretty amazing. So less waiting around for patients and they get to the right expert faster?
Exactly.
Okay, so that's faster referrals, but what about the actual treatment itself?
All right. Well, let's talk about those gooey impressions.
I bet you've had those done at some point, right?
Oh, yeah, way too many times.
They're awful. And Dr. Baxman mentioned how tough they are for people with sensitive gag reflexes.
Absolutely. But guess what? AI has come to the rescue again.
No way. Tell me there's a better option.
There are AI-powered intraoral scanners.
Okay, what's that?
They create these incredibly detailed 3D models of your mouth.
Seriously?
And get this, AI also helps with analyzing those scans to design appliances, figure out where to put brackets, and even simulate how your teeth will move.
Wow, so all that before treatment even starts?
It's about as personalized and precise as you can get.
I bet patients are over the moon about that.
Studies actually show that patients much prefer these digital impressions over the old school ones.
Makes total sense. It's faster and more comfortable, and I mean, who wouldn't want to see a 3D model of their own teeth?
It's pretty cool. And speaking of cool tech, clear aligners are all the rage these days.
Dr. Baxman talked about how AI is making them even better.
It really is. Clear aligners are already so convenient, but AI is like fine-tuning them to each person's needs.
I'm intrigued. Tell me more.
AI algorithms can analyze data and predict tooth movement, so you get a super precise and efficient treatment plan.
So it's like a custom treatment that's always adjusting based on how your teeth are actually moving?
Exactly. And here's the really wild part. We're starting to see AI-powered at-home aligner designers pop up.
Wow, seriously?
Yeah, it's crazy. But like Dr. Baxman said, you still absolutely need expert supervision.
Of course. AI is amazing, but it's not replacing orthodontists anytime soon.
But it is changing the game in some really exciting ways.
So Dr. Baxman also talked about how AI is impacting remote dental care. This is where things get really interesting, especially if you've ever wished you could just skip going to the doctor altogether.
Oh, tell me about it.
Right? Well, Dr. Baxman brought up a great point about how crucial remote monitoring systems became during the pandemic.
People could still get the care they needed without in-person visits.
Exactly. And that's where things like dental monitoring, or DM, come in.
Oh, yeah, I've heard of DM, but I don't really get how it works. Is it actually AI-powered?
DM uses deep learning to keep tabs on how your teeth are moving.
So how does that work in practice?
Patients take pictures with a smartphone app, send them to their orthodontist, and then the orthodontist can monitor their progress from anywhere.
It's like having your orthodontist in your pocket.
Exactly. Dr. Baxman said that DM isn't just about tracking progress. It can actually help improve your oral hygiene, too.
Really? How's that?
Those weekly DM scans, plus the personalized notifications through the app, all help patients stay on top of their brushing and flossing routine.
So AI is reminding you to brush your teeth.
Absolutely. It's crazy to think how much AI can do.
It's seriously impressive. And speaking of AI doing amazing things, we can't forget about all the hype around chatbots, like ChatGPT.
Oh yeah, ChatGPT is everywhere these days. But can it really give good advice about complex orthodontic stuff? I mean, it seems like a stretch.
It's a good question, and Dr. Baxman actually talked about that skepticism. He mentioned a study that found ChatGPT was surprisingly good at giving accurate info about things like temporary anchorage devices or TADs, digital imaging, and even clear aligners.
So it's not just for basic questions, it can handle the technical stuff too?
It can. Of course, like with any AI tool, it's not a replacement for a real orthodontist. But for quick answers and general info, chatbots are proving to be pretty valuable for patients.
And Dr. Baxman pointed out that they can also help with communication between patients and orthodontists, which can lead to happier patients and make the whole experience a lot more approachable.
That makes sense. It's like having instant access to info and support, which can be so helpful, especially if you have a question outside of office hours.
Right, it's all about convenience. So we've got faster diagnosis, more comfortable impressions, remote monitoring. It seems like AI is touching everything in orthodontics.
And it's all to improve patient care.
Yeah, it's pretty amazing. Dr. Baxman really painted a picture of a future where orthodontics is faster, more precise, and totally focused on the patient.
I agree. And at the heart of it all is patient satisfaction. As Dr. Baxman said, all these AI tools help reduce appointments, shorten treatment time, and improve communication.
Wouldn't it be amazing if all healthcare was that quick, precise, and convenient?
We can all dream, right?
But it really makes you wonder, huh? What will orthodontists even do in a future where AI can handle so much? Will they be replaced by robots?
That is the million-dollar question. Dr. Baxman didn't shy away from it. He acknowledged that AI could automate a lot of what orthodontists do, but he also said that AI is a tool. And like any tool, it needs to be used responsibly and ethically.
So it's not about AI versus orthodontists. It's about figuring out how they can work together.
Exactly. The future of orthodontics is probably going to be all about collaboration. AI and human expertise working as a team.
That's definitely a more reassuring picture of the future. But it also raises some new questions.
Like what?
Like, how do we make sure AI is used ethically in healthcare? And how do we train orthodontists to work with all this new technology?
Those are great questions. And they really highlight how important it is to keep talking about all this as AI keeps evolving.
It's true. We need to have these conversations now to make sure AI is used in a way that benefits everyone.
I couldn't agree more. And I think Dr. Baxman would say that it's everyone's responsibility. Patients, orthodontists, developers, we need to work together to shape the future of AI in healthcare and make sure it's ethical, responsible, and truly benefits patients.
So it sounds like we're on the brink of a really exciting, maybe a little bit scary future for orthodontics.
Exciting for sure. And while Dr. Baxman gave us a lot to think about, there's always more to explore, right?
It's the beauty of it all.
So to everyone listening, we hope this has gotten you thinking about AI and healthcare. What are your hopes and fears about all of this? We want to hear from you. Keep exploring, keep asking questions, and keep learning.
Yeah, it can handle some of those more technical questions too. Of course, you always got to remember, like with any AI tool, it's not going to replace your orthodontist.
Right, it's a tool, not a doctor.
Exactly. But for quick answers and general info, chatbots are becoming super useful for patients.
Definitely. They can even help with communication between patients and orthodontists, like Dr. Baxman said.
Yeah, exactly. And that can make patients happier and make the whole orthodontic experience less intimidating.
It's like having access to information and support whenever you need it, which is so reassuring.
It's all about convenience. So we've talked about faster diagnoses, those amazing 3D scanners, and remote monitoring. It seems like AI is really changing every part of orthodontics.
And it's all focused on improving patient care.
It's pretty incredible. Dr. Baxman really gave us a glimpse into the future of orthodontics, where everything is faster, more precise, and really all about the patient.
Yeah, he did. And when you think about it, it all comes down to patient satisfaction. Like Dr. Baxman said, all these AI tools help reduce appointments, shorten treatment time, and make communication better.
And then it makes you wonder, why isn't all healthcare this quick, precise, and convenient?
Wouldn't that be nice?
But it also makes you think, what will orthodontists even do in a future where AI can do so much? Will they be replaced by robots?
That's the big question, isn't it? And Dr. Baxman was totally upfront about that. He acknowledged that, yeah, AI could automate a lot of what orthodontists do. But he also emphasized that AI is a tool, and like any tool, it has to be used responsibly and ethically.
Right. It's not about replacing humans. It's about figuring out how AI and orthodontists can work together.
Exactly. The future of orthodontics is probably going to be all about collaboration, AI and human expertise working hand in hand.
Now that's a future I can get behind.
Like, what kinds of questions?
Well, like, how do we make sure AI is being used ethically in healthcare? And how do we train orthodontists to use all this new tech effectively?
Those are really important questions. It just shows how crucial it is to keep having these conversations about AI as it keeps evolving.
It's true. We need to be talking about this now so we can make sure AI is being used to help people, not hurt them.
I totally agree. And I think Dr. Baxman would say that it's up to all of us, patients, orthodontists, developers, to make sure that happens. We have to work together to shape the future of AI in healthcare, make sure it's ethical, responsible, and puts patients first.
It sounds like we're standing at the edge of a really exciting, maybe a little bit uncertain, future for orthodontics.
Exciting for sure. And even though we've learned a lot from Dr. Baxman today, there's still so much to explore.
That's what makes it so fascinating.
Absolutely. So to all our listeners out there, we hope this has gotten you thinking about the role of AI in healthcare. What are your hopes and concerns about all this? We want to hear your thoughts. Keep exploring, keep asking questions, and keep learning.
Yeah, it really is amazing how tech, and especially AI, is changing orthodontics.
You know, Dr. Baxman really gave us a lot to think about.
He really is leading the way in this whole AI and orthodontics thing.
And I think what stuck with me was that AI isn't about getting rid of that personal touch in healthcare. It's like it can actually make it better.
That's a great point. We've talked about how AI can make things faster and easier, but it's not just about being efficient. It's about making the whole experience better for the patient, right?
Exactly. Like, think about it. All those AI tools can free up orthodontists so they have more time to actually spend with their patients, explaining things, answering questions, really listening to their concerns. That personal attention can make a huge difference.
I bet it does. It's about using tech to help those human interactions, not replace them.
And when you think about how AI can personalize treatment plans and do all that remote monitoring and even make communication smoother, it really seems like it can make orthodontics so much more patient-focused.
It really can. And like Dr. Baxman said, it's important to remember AI is a tool, and like any tool, it can be used in good ways and bad ways.
True enough.
So it's up to all of us, patients, orthodontists, developers, to make sure AI is being used ethically and responsibly in healthcare.
Yeah, that's a really important point. We need to be aware of the potential downsides, even while we're excited about all the possibilities.
Exactly.
Well, I think that's a good place to wrap up our conversation. We've covered a lot of ground today, from how AI is speeding things up to improving communication to even making remote care a reality.
It's been a really eye-opening conversation, and we owe a huge thanks to Dr. Baxman for sharing his expertise and his vision for the future.
Absolutely. His insights have given us so much to think about, and I hope they've inspired our listeners to consider the role of AI in their own lives.
And to everyone listening, we'd love to hear your thoughts. What are your hopes and concerns about the rise of AI in healthcare? Let us know, and until next time, keep exploring, keep asking questions, and keep learning.